in between these question papers, my aim is to revise through certain BNS sections and also to look into some of the important key points in diagnosis. Okay. So we're going to be fast. It's a revision class. It's not a teaching class. So we are not going to be slow. If you find it's pretty fast, do drop in a message that like, ma'am, slow down, so that we would slow down. And also, if there is any doubt, put it in the chat box. Most probably, we will take it at the end of the session until and unless, it's like a very important point and you need to get it cleared then and there. All right. Okay. So let's get started now. Let's start with the questions. All right. Try answering this question. This is 2025, this year exam questions. Try answering it. What is the correct answer? Try answering it. You're going to apply the rule of 9. Apply the rule of 9. Is my screen visible to you guys? Very good. Very good. Very good. Very good. Okay, so see, anterior chest and both upper limbs, these are definitive, right? 9% plus 9%. Anterior chest gets another 9%. Now you have the face alone that you have to calculate. So this alone gives you 27%. Face 3%, 3.5, right? Like you apply the rule of palm also. So they have given only face without the scalp, without the neck. So it comes around 30%. So 27 to 30 would become the correct answer. Very good. Okay, the next question. Triad. What is the correct answer? 65 of you are there. Try to answer it. I'll share the notes with you. I'll share the questions with you. So focus on trying to grasp as much as possible. Yes. Very good. Very good. Okay. So abrasion, a contusion and punctured lacerated wound. Very good. Bomb blast. Primary injury or secondary injury or tertiary injury or quaternary. Which category does it fall under? Primary, secondary, tertiary or quaternary blast injury? Which one it is? Very good. Very good. Very good. It is secondary. Also, can you tell me what is the agent that causes it? What causes this? What are they called as? Like the primary is barotrauma, secondary is very good, very good. Try answering, all of you try answering. Yes, it is flying missile. Very good. It is flying missile that causes it. Very good. One last question. What is this triad known as? What is this triad known as? Very good, very good. It is Marshall's triad. Okay, Marshall's triad. The abrasion, contusion, and laceration in bomb blast injury. All right. What about this one? Which of the following option with respect to the BNS section is wrong? Very good, very good, very good. Severe bodily pain. Okay, what should be the correct answer? Severe bodily pain for how many days would you calculate it as grievous hurt? What should be the number of days? Very good, very good. It should be 15 days is grievous. Okay, very good, very good. All right. Okay, let's go to the next question. Yeah, fourth question. What X-rays will you take in this case? Very good. Very good. D becomes the correct answer. Okay. So with respect to this, let me ask you some questions. The wrist joint, it is very clear. The distal end of radius and ulna will fuse at around like 17 to 19 years, right? One from 17 to 18 and another from 18 to 19. So distal end of radius and ulna. Okay. Okay. Now, let me ask you with respect to the upper end of radius and ulna and the lower end of humerus. When will they fuse? That is, I'm asking about the elbow. Elbow, upper end of radius and ulna. Very good. Very good. Very good. Around 16 to 17 years. Okay. Very good. Okay. Next, what about the shoulder joint? Shoulder. That is the proximal end of the humerus. When will they fuse? Very good. 18 to 19 years. Okay, very good. Okay, what about our iliac crest and ischial tuberosity? Iliac crest and ischial tuberosity. In pelvis, iliac crest and ischial tuberosity. When do they fuse? Very good. Okay, see, 21 is considered as an ideal age. Generally around 20 to 21, we expect its fusion to happen. All right, let's take the medial end of clavicle. Okay, medial end of clavicle appears at medial end of clavicle appears at very good 18 to 19 and fuses at 8. Very good, very good. Okay, see, for Indian adults and everything, it's expected to fuse earlier also. You can expect it to fuse in the 18 to 20 range or even in the 21 to 22 range. Both it can happen. Okay, so generally 20 to 22 is taken as the correct answer. 20 to 22. Okay, 20 to 22, it fuses. All right, good. All right, let's try the next question. Dental charting. Dental charting methods. Very good, very good. Palmar notation is the correct answer. Palmar notation gives numbers just like this, 1, 2, 3, 4. And if I just indicate by 1, I'm talking about the upper right central incisor. If I put it as 1 on like this, then I'm talking about the left upper. Okay, so this is Palmar notation. Okay, so this is Palmar notation. Hard nap will contain plus and minus and all. Okay, the upper row will have plus, the plus will be there in front, first will be there in the back. That's all hard up and everything. Universal numbering will continue from 1 to 32. They will continuously number 1, 2, 3, 4, 5, 6, and it's pretty difficult to remember also. Then comes the FDI formula. FDI formula gave one prefix. Okay, so they said this is quadrant 1, 2, 3, and 4. So then they said like 11, 12, 13, whereas 21, 22, 23. This was FDI. Okay, so this was FDI system. We have then our universal method. Palmar notation is where we do like this. It's giving numbers and then you draw the numbers, draw quadrants. It has become famous now with the introduction of the what do you call the electronic medical records, right? So now people can draw and click and also that becomes the easier part. Okay, the next one. It's a comparatively very easy question. Yes, next one. Let's do. Very good, very good, very good. Okay, two registered practitioners are generally required at 20 to 24 weeks. Two medical practitioners are required at 20 to 24 weeks. All right. Okay. More than 24 weeks. How many people are required? More than 24 weeks. Very good. A board is required. What is the indication for more than 24 weeks? The indication for more than 24 weeks. Very good. Very good. Congenital anomalies. Yeah. Okay. Congenital anomalies. They can go for an abortion for more than 24 weeks. Okay. 20 to 24 weeks is also restricted. Mainly it is for, currently they are giving it for rape, change in marital status, or any war has been declared. Okay. So civil war or any other war like that all happens, then they are allowing beyond it. All right. Okay. The next one, match the following. Again, an easy question. This one. Go for the easiest ones first. Oh, Vinter. Go for the easiest one first. Very good, Dr. Janani. Good. Go for the easy ones. Okay. See, I would match metals with lead first. This is one of the easiest that you can do. So that gives me only two options, A or C. All right. Now, if I say organic irritant, I am not thinking about opioid, I'm more thinking about croton. Okay. Similarly, if I'm thinking about depressant, I'm thinking more in the level of opioids, right? So C becomes the correct answer. Okay. So C becomes the correct answer. All right. Next one. Yeah. Next one. Okay. Very good. Very good. Tremor, Mad Hatter's shake, right? What is the, now questions to be answered. What is the neuropsychiatric behavioral change seen in mercury exposure known as? Neuropsychiatric. In mercury poisoning. Very good. It is erethism. Okay. What about if the person has a reaction, allergic reaction? The person has a scarlet-like feature similar to skin and all becomes very red. Very good. Very good. Hypersensitivity in mercury is very good. Acrodynia. Okay, the other names are, it is also known as the pink disease or it is known as the Swift disease. All right. What is the name when fish eating population in Japan got it? Very good. Very good. Good. Very good. Minamata disease. All right. Now let's answer other questions also. Lead lines in X-ray is seen in case of lead. Basophilic stripplings are seen in case of Lead, another thing that they can give with lead is known to cause encephalopathy. Okay. Basophilic stripling, Bartonian's line. Right? It is known to cause it. It affects the heme synthesis. Anemia. Look for the word anemia. Anemia is more specific for lead. And even colicky pain, abdominal pain the patient presents with. Think about lead. All right. Okay. What about this one? The hyperkeratosis and Mees line. What do they indicate to you? Hyperkeratosis with Mees line. Very good. It is arsenic. Okay. Can you tell me the other features that are seen with arsenic that we are worried are in acute? You get cholera-like features and you get red velvet stomach. Okay, you get a red velvet-like stomach. Okay. Now, if the same Mees line with alopecia means, what do you think of? If the same Mees line with alopecia means? Very good, doctor. Very good. Thallium. It is thallium. Very good. Okay, good. Next question. Try answering. Color turned black. Very good. Silver nitrate is aluminum phosphide. One more thing that we remember with phosphide, aluminum phosphide, is that it can fumigate. And also remember that you can use magnesium sulfate to stabilize heart. Patient dies because of arrhythmia only. So you want to stabilize the heart, so you're going to give magnesium sulfate. All right. Okay. The next one. With reference to the snake envenomation, which of the following statement are correct? Statements are correct with respect to the snake envenomation. Correct statement they are asking. I'm not able to see the chat. Yeah. They have asked for correct. Okay, which of the following are correct is their question. Okay, let's take each statement. Vipridae produce vasculotoxic effects, right? This is a correct statement. Elapidae venom is primarily myotoxic. This is not a true statement. Okay. Spread of venom occurs via lymphatics and superficial veins. Lymphatic is the main one. So this is also a correct statement. Okay. Hyaluronidase is present in all snake venom. See, if it is a venom, it has to spread. So hyaluronidase is present. Okay, so hyaluronidase is present. But see, they have not given a combination of these. So the better answer would be to go for this, A. Ideally, all these are correct. A, C, D should have been the correct answer. Okay, so A and C are the best. The second best option is this, A and D. Okay, yes. All right. Yes, sometimes they place the questions very nearby and they do give the marks based on that. But then like these are very near options. Okay, A, C, D. All three are correct only. Okay, venom spread occurs mainly through the lymphatics and the veins are less, but like through the lymphatics. All right. Okay, the next one. Try this. The last question. Toxic action of cyanide and carbon monoxide is due to. Very good, very good, very good. Can you name 2 more agents which will act through the cytochrome C oxidase? 2 more agents. Can you tell of 2 more agents which can act through, yes, H2S, and 1 more agent? One more, yes, cyanide is given. Cyanide is given, carbon monoxide is given, H2S, and 1 more. Nitric oxide in the reverse way. So yes, very good, Dr. Monisha. Nitric oxide was also there, but it's in the reverse way. So the better answer is aluminum phosphide. Yes, very good. Good. Okay, aluminum phosphide is the next one. All right. Okay, now that we have done one set of questions, let's see through few of the toxicology. Yeah. All right. Quickly revise through it. I hope the screen is visible to you. Quickly revise through it. Greenish brown or olive green color urine which turns black on standing is carbolic acid. Nitric acid, nitrics, or anything that they give nitric, brown colored. All right. The same thing, nitric acid, if they ask you the stomach color, right, it will again go towards the brown only. All right. Okay. Whereas if they stomach color means it will go towards the yellow. Okay, it will be yellowish brown, yellow picric acid. Okay, so the same if they ask for stomach, I think I've given it below. Yeah. So this one, pay attention that if it is urine, you're getting brown color. Okay, if it is the color of the stomach wall, it will become yellow in color. All right, yellow in color. It will go towards the mustard yellow color. All right. Next, amphetamine. It's known as the liquid gold because of its value in the black market. All right. Meiosis. We said meiosis means comb, small, right? COMB. That was our mnemonic. Okay. Carbolic acid, chloral hydrate, our O. Remember our organophosphate, opium. From the organophosphate and opium itself, morphine, muscarinic agent, and B for barbiturates. All right. So these are the agents, comb agent. Then you have mydriasis. Mydriasis, remember it as ABCD. ABCD. Okay. A for amphetamines, B for atropa belladoma, C for cocaine, and D for datura. All right. So remember these agents. All right. Similarly, remember that just revise through the smell. I have kept only the important smell one. Shoe polish order, nitrobenzene. Fruity order, acetones, alcohol, chloral hydrates, get it. Fishy order, aluminum phosphide. Rotten egg smell, hydrogen sulfide. Kerosene, arsenic, and phosphorus. Phosphorus, this is, okay, which produces the phossy jaw. Phossy jaw. Right? And this is the one that gives luminous vomiting. Luminous vomiting. Right? That's phosphorus. And then, of course, if it is a burn, brittle almond smell, it's cyanide, and burnt rope smell means it's cannabis. All right? Yes. Bullous eruption, antemortem period, barbiturates and carbon monoxide because of the anoxic effect. And apart from it, burns can also produce it. All right. Now, alcohol has 3 things: delirium tremens, Wernicke's encephalopathy, and Korsakoff psychosis. Remember, Wernicke's encephalopathy, when it becomes over a period of time in deficiency, results in Korsakoff psychosis. When they say psychosis, they want you to remember mainly symptoms that are related to, the psychological or psychosis, you can say. Hallucination, disorientation, confabulation. See, for confabulation to happen, the person should have first amnesia, right? He has to forget something to fill the gap in memory, right? Filling the gap in memory is confabulation, right? So first amnesia should happen or loss of memory should happen, and then only he goes in for confabulation. All right. So this is this. Wernicke encephalopathy features we should remember. Delirium tremens we should remember. All right. Okay. Let's go back to our question. Last year question. Marshall triad. Again, they asked what is the correct answer. Now we can go a bit more faster. Marshall triad. What is the correct answer? Very good. Very good. Very good. 2. Good. Secondary blast injury. Yes. The next one. Which of the following is not seen in heat exhaustion? They're not talking about the heat stroke. They are saying about heat exhaustion. Very good. Very good. Very good. loss of thermoregulatory function. Can you tell me the temperature in Fahrenheit and in Celsius? What is the temperature for to call it heat stroke? Heat stroke temperature? Yes, it is 41 degrees Celsius or 106 degree Fahrenheit. Okay, 41 degree or 106 degree Fahrenheit. Okay, very good. Next one, currently matched antidote. Currently matched with the antidote is very good. Benzodiazepine is currently matched. Okay, organophosphate, what is the antidote? Organophosphate, what is the antidote that you will give? Very good. The primary is atropine, and the second agent that you can use is oxines. Yes. Whereas for atropine, what will you use? For atropine, what will you use? Very good, doctor. You will use physostigmine. All right. For arsenic, what is the agent that you will use? Arsenic. You have to use a chelating agent. Which chelating agent you will prefer? Very good. British anti-Lewisite. Yeah, British anti-Lewisite, also known as dimercaprol. They can use this name also, dimercaprol. All right. All right. Next question. Compound given below. Again, every 2 years once, or like every two question paper once, they ask weird questions. So this is one of the weird questions. No more used, no more practically used anymore. Where do we use copper sulfate as treatment, or where was copper sulfate used in treatment? Very good, doctor. In history, all right. In phosphorus, it was used. In phosphorus, it was used. Very good. Very good, doctor. Okay, the next one. Presented with shock, pulmonary edema, silver nitrate was positive. The treatment is magnesium sulfate. We have seen this, right? What is the diagnosis that we had? What is the diagnosis that we had? Very good. Okay, so this we have seen, it's aluminum phosphate. So aluminum phosphate, magnesium sulfate becomes the correct answer. Okay, cytochrome oxidase is you see, it is blocked in all except very good, doctor. Nitric oxide. Okay, nitric oxide, it works in the opposite way. All right, good. Okay, the previous, so you can see the pattern, right? Like in November of last year they asked 6 questions, but in the month of May they have asked around 12 questions, right? So it doesn't mean that like November they won't ask. They vary from 6 to 12 questions. That's the average that we are seeing. All right, what is the crystal that we are seeing? See with the muscle features itself, you can say tetany, muscle cramps. Very good. Calcium oxalate. Very good. Calcium oxalate. Okay. What is not seen in, or like not much associated? It can be seen, but not still much associated. Very good. Very good. Ophthalmoplegia. Not much seen with Korsakoff psychosis. Okay. Then next one. Potassium level is low. Low potassium level. Rest all it will mimic aluminum phosphide. Just the low potassium level will tell you something else. Very good, very good, doctor. It's a barium compound. Very good. Okay, the next one. Antidote for cyanide toxicity. Antidote for cyanide toxicity. Yeah, 2 is the correct answer, right? You can use this, you can use this, you can use this, right? So 1, 2, 3 becomes the correct answer. Yes, very good. Okay, the next one. What is the order of opening the cavity in a fetus? Fetal autopsy. What is the order? head, abdomen, and thorax, right? So this becomes the correct answer. All right, very good. Match the following. Match the following. Go with the easier one, you would still be able to do it.